Hello there, everyone. Welcome again to this next edition of the High Five. I am really pleased to be able to introduce you today to Tracy Stuart from NBS Training. So, Tracy, welcome to our High Five. I'm not sure if I told you the format, but broadly speaking, you get five questions. If we want to talk a bit longer, that's kind of okay too. But I really wanted to kind of introduce you to our audience, if that was okay.
Absolutely perfect. Loving the opportunity. Thank Ross. Do I get a pass at the end?
Pass.
Do I get a pass at the five questions?
Yeah, no worries at all. You obviously kind of introduced you by name, but yeah, tell the audience a little bit about your background, I suppose. Maybe that's a good way to lead off.
Well, I suppose I've been in dentistry forever. I actually started working in a dental practice when I was 15, and I had my days off to go and do my exams and then come back to the practice. So I was managing practice by the age of 19.
Wow.
So there isn't really much I haven't done apart from the dentistry. So I've been the nurse, I've been the receptionist, I was one of the first treatment coordinators in the UK. I've been the
Yeah.
practice manager, the business manager. I've worked with companies that value and sell dental practices. I've worked with marketing companies. And then in 2013, I got big and brave and set up on my own. And I must be doing something right because I'm still here.
Yeah. I feel like I need to ask, where were these practices?
Where I was working,
Yeah,
most of
yeah.
the practices I was working with were London based because that's where I grew up and spent most of my life. So really in between London and Hertfordshire.
Yeah, fantastic. Excellent. So, you've been doing your own consultancy and coaching then, so well, over 10 years now. Amazing how time flies, isn't it? Uh, what have you kind of seen along the way, and where are we at now? What are your kind of perspectives? I'm going to have to kind of keep you time bound on this now because I know that we can probably talk until the cows come home on it. But what are you seeing in dentistry?
I think, first of all, I'm seeing a lot with the way that technology is changing things. So there's almost like your old school patient journey and there's your digital patient journey. So, things like people not actually using WhatsApp correctly, not using their CRM correctly. There's lots of leads coming in. There might be 90 leads a day. You've got two receptionists. They're overwhelmed with everything that they've got to do. Um, a lot of people are reporting they're contacting the leads and they're not getting through to people. There's usually a reason for that, but it needs somebody to look a little bit deeper with a different pair of glasses. Private patients, private practices saying, it's not a problem acquiring the patients, but these private patients, they're bloody rude. But if you think about it, they're not even an independent patient. They're a really irate NHS patient that can't find an NHS dentist. So you can get them onto the plan pretty quickly. But then even a small treatment plan of £2,000, you know, dentists are having to do things in a different way
Mm.
and communicate and engage with people in a very different way. I suppose I should stop there, Ross, because I could actually go on all day with.
Well, but it is. I know some. There might be kind of someone looking at this and saying, like, yeah, I get all of that, but is it important? Can't I just kind of make sure I'm doing all the dentistry that's kind of required? Why do I have to be kind of concerned about all these kind of problems that happen outside the surgery?
Because if you want to see the patients, you've got to get all the entry bit correct. It's a bit like people, a lot of what I'm seeing is, getting patients through the front door and you've opened the back door and let them out again because things aren't actually being handled efficiently. And even things like, after the new patient appointment and the treatment plan, even actually carrying out a Loom video and engaging with the patient. You've just got, if you want things to be successful, then you've got to actually put the work in. There is no magic pill and there is no fairy dust. I'm sure people think that I come along, wave a magic wand, and everything's going to change. So, I'm very clear with people that I work with. We've got 12 months as a minimum, doing things different, which is going to impact a lot of change. And the thing is, the person that's actually paying for me to come in, which is usually the practice owner, isn't the person that has to make a lot of all these changes. It's
Mm.
the people that didn't know I was coming in. And if I come in and that plan hasn't been communicated, and I say to the team, what do you know about me and what we're doing? Well, I just saw Tracy Stuart was in the diary. I didn't know if it was a patient. So things have, when things are going wrong and there are problems, there's always a reason.
Yeah, yeah. From our perspective, we work with any number of practices on, very different kind of levels, but the kind of the universal kind of theme is this kind of, I don't know, disconnect between the dentistry and the operations. I mean, what I call the operations is kind of anything non kind of clinical, non-surgical. But there's, I think there's just so many holes in this kind of leaky bucket that it can be kind of quite frustrating, I suppose. So you started to kind of touch upon it there about how you go about things as well. So you alluded to kind of a 12-month program there. Like, does it have to be 12 months, Tracy, in your opinion? How do you work with practices?
It doesn't have to be 12 months, but for things to actually change and for you to actually keep those new habits in place, it can't happen, in one session. So, for example, 16th and 17th of May, I have a front of house TCO workshop. That's probably the entry level. I then have a 3-month coaching program, which is tailored to a practice right up to the 12 months. But one of the things I would say, Ross, if people are thinking 12 months is too much, on average, my clients stay with me between 3 and 5 years. Once you've got those changes in and you're seeing the results, you don't want to go backwards.
Yeah. Well, it's this. I think it's quite natural for people to get, yeah, but can you just sort out that receptionist or or that manager or whatever it might be? But kind of doesn't work like that, really. There's no just involved with things, and and probably to be very clear to our audience as well, the economic outcomes that we see that can benefit your bottom line, your P&L by working on your practice are, we're not talking about little amounts. We're talking about wholesale changing and tens of thousands of pounds, arguably hundreds of thousand pounds of profitability increases. I'll happily tell them, Tracy, that's what you affect. I know you'll probably be modest in what the outcome, but these things are really important to dental businesses at the moment, aren't they?
Yeah, and I think with what you said, that if you we're going to pick on one thing or highlight one area, it is that operations manager role that is crucial to everything. So, for example, after our meeting today, I'm going to be heading on to a reception meeting and where we've got the spreadsheet of how many inquiries that have come in and have they come in via email, they come in from a CRM system. But a lot of people are not looking at when did that lead or inquiry come in? How long did it take us to respond to it? I have call recordings. I've got the telephone number of that particular lead. Well, I can't find that actual number on the call recording system because the call was never made. So how do you expect to actually convert that lead? But somebody in the practice has got to be looking at everything. I've got the WhatsApp screenshots, I've got the WhatsApp voice notes, I've got everything to put that puzzle together. So I know what's working and why it's working, but I also know what's not working and what we need to do about it.
I think that's a really good way of putting it. It's putting that puzzle together, like moving the kind of pieces around so the picture kind of comes into shape. Uh, and it kind of goes back to this. Well, is there a quick fix to kind of running a practice? Like sometimes there is, but usually the picture doesn't look like a picture until it actually looks like a picture, and you need to kind of move all those pieces around. And as you say, kind of go into the practices and audit what's going on. What's the kind of the normal content in your 12-month then? Is it mixture of kind of site visits and remote assistance? Is
Yeah,
it? How's it work?
so we've got different programs. We've got the workshop, which is entry level. There is a
Yeah.
specific 12-month plan purely for practice managers and developing them. And then there is the NBS profitable growth plan for dental practices. And for that, there are 6 on-site visits over the course of the year. And then there are monthly Zoom sessions. And that will be for the practice manager. They'll be separate for the reception team. As I just mentioned, I'd have all that information of data. So I've got a full picture of what's going on. Even though I'm not in the practice, there is a lot that can actually be done virtually. We have a private WhatsApp group for all the owners in that program. We have a private WhatsApp for all the managers. They also come together, all the managers come together monthly, all the owners come together quarterly via Zoom. I think I'm on call, it feels like I'm on call 24 hours a day with WhatsApp at the minute. I've had to turn my bloody phone off so we don't actually get disturbed while we're doing that. But it's the level of support, when that owner's up at 4 o'clock in the morning and they can't actually sleep, they know that they can actually send something over. They're not getting a response at 4 o'clock in the morning, but it will be there and I will get back to them as soon as I can.
Yeah.
It's they've got somebody that's there for them, not your
Yeah.
9 to 5.
Yeah. Well, what I'll happily say is that, we perhaps coincidentally kind of hooked up probably two odd years ago now, but I love the work you do. We work together on with many cases and clients. What you offer, it's a well-trodden path, isn't it? You've got over a decade of experience with hundreds of practices now, haven't you?
Yeah, and the thing is, the key is anyone can deliver a program, anyone can bring in a fancy PowerPoint, but it's can you win people over? So it's also the coaching background that I have. So not just
Yeah.
the practice manager qualifications, but the coaching, getting the best out of people. And it's like a football team. The coach has got to get the best out of people because some days they're great and some days they're not. And when the football player messes up, it's not usually that they've actually, kicked the ball the wrong way. There's a lot maybe going on inside their head and they're not in their best place. So if your team are not in their best place, if they're not equipped with the tools to cope with life, if they don't understand themselves because they haven't got that level of self-awareness, if you haven't got that level of self-awareness, how can you manage yourself better? And if you're
Mm,
not managing yourself better, what can you do for others?
mm. Cracking. How could any interested parties get in contact with you? What's the best route for them?
Best route nowadays is WhatsApp. More than happy to give my number, or I don't know if you want to pop it
We'll,
on
we'll,
at
we'll
the
make sure it
end.
scrolls across for people and they get it there.
Or if you're really old fashioned, you can pick the phone up. I still answer mine, unless it comes along spam.
No, fantastic. So, well, it's been, it's a delight. It always is a delight to be working with you, with clients. The symbiosis that we provide together, it does transform practice. So I would say, don't hesitate. Pick up the phone to Tracy, or drop her a WhatsApp, and she will help your practice out with her and her team.
Lovely. Thank you so much, Ross.
Thanks, Tracy. Cheers.
Bye.